Hi, my name is Corey Ramgrant, and today I'm going to demonstrate a proper postpartum exam for you. First off, this patient is technically a med-surg patient, so we're going to do a proper head-to-toe exam on this patient. Obviously, we're going to examine everything head to toe, including your head, eyes, ears, nose, mouth, and everything below the head, but there are a few things we will want to highlight for a postpartum patient. We want to highlight the push and pull of the hands and feet, eye reactivity, GI sounds. I will go into this a little bit more in a couple minutes, but we want to highlight the GI sounds because mom's at risk for constipation. We want to monitor lung and heart sounds, and we want to monitor her vital signs and her pain, along with capillary refill and skin color. I will also highlight that in a couple minutes, but we want to do capillary refill and skin color because moms are at risk for hemorrhaging. After you do your physical exam, you're going to be doing a bubble heat exam, which includes breast, uterus, bladder, bowels, lochia, episiotomy, Holman sign, and the emotional status. So we're going to start at the top with breast, and then we'll slowly go down. With breast, you want to check that mom's breasts are symmetrical, no redness, no edema, no warmth, and you want to see how full her breasts are, along with what type of milk is coming out. I will just touch on this, but most of the time in the hospital, your mom is going to be putting out colostrum. Colostrum is a thick, white substance coming from the breast. This is very important for baby because it passes immunity from mom to baby, otherwise known as passive immunity. Colostrum also has antibodies that the baby will need. Even if mom is not planning on breastfeeding, we want to try to educate her and get her to at least pump enough colostrum to give baby, especially if they're in the NICU. After breast, we have uterus. Uterus is very important. If you were to miss this step, it could be detrimental to mom. So I have my pregnant belly here, and we're going to try to measure fundal height, and I will explain everything that goes into that. So first off, we're going to say that this is mom's belly button or umbilicus. We're going to say that that side is mom's head and breast. We're going to say this side is her groin area and feet. So we're going to start by taking one hand and placing it on mom's umbilicus. We're going to take another hand and place it over her groin area. And then we're going to gently but firmly palpate that uterus. We're looking for whether it's firm or boggy. If it's firm, that's a good sign. That means that the uterus is clamping down and stopping any bleeding. If it's boggy, it's the complete opposite. The uterus is not clamping down and the mom could very well be bleeding. After we palpate the uterus, we're going to check for fundal height. Same thing, one hand on the umbilicus, another on the groin. We're going to walk our fingers down and see when we hit the top of that uterus. So it should be firm. Postpartum day 1, mom will be one finger length away from the umbilicus and the uterus. And little by little, it should be more finger lengths away because the uterus is practicing involution, where it will slowly go down to its normal size and be with the cervix. If you happen to come in the patient's room and it's 1 or 2 fingers above the umbilicus, that's a bad sign. That means that the mom could currently be bleeding and it's stretching the uterus out. Along with fundal height, we want to make sure that uterus is midline with mom's body. If you come in the room and you see that the uterus is not midline, there could be a reason for that. Mom's bladder could be completely full and pushing that uterus over. So what we're going to do is ask mom to go into the bathroom and void, come back, and we're going to remeasure fundal height and make sure that it's midline this time. And that's all you need to know about fundal height in the uterus. Next, we're going to go over bladder. Moms are at risk for a couple things regarding the bladder. They can have retention distension, and they can have UTIs. So we want to make sure when we're doing that physical exam, we gently palpate the abdominal area and we see if there's any distension. And then we want to check for UTIs. If mom is experiencing any burning, pain with urination, or even difficulty urinating, we might want to run a urine culture. Now we're going to go over bowel. Because of the fight or flight response in labor, the body will slow down the GI system. Along with that, mom is not moving much. And then along with that, we may be giving her narcotics, which we should know slow the GI system down. So moms are at a great risk for constipation. The way we can be proactive and help her with this is to get her up postpartum day 1, get her walking around the halls. We would like her to walk at least 3 times a day, but obviously this depends on what mom's willing to do and what she can do. But we want to get them up, get those bowels moving, and get mom to produce a bowel movement. Next we have lochia. There will be 3 stages of lochia that you will need to keep in mind. First we have rubra. This is a dark red, almost all blood discharge. This will last 3 to 4 days. Then we have serosa. This is a tinged pink discharge, light pink, and this will last 4 to 10 days. Lastly, we have alba. This is a yellowish white discharge. It'll last from after day 10 to sometimes 14 days, but everyone is different. There are a few things you need to know about rubra. Number 1, soaking through a pad an hour is too much blood. But we want to pay attention to if there's that much blood because of postural drainage, where mom was sitting a certain way and there was a pocket of blood in her vagina and then she moved and it came out, or if she truly is just constantly bleeding, creating the pad being saturated in an hour. In order to determine if it's life-threatening, we want to look at lab work, vitals, your physical exam. Was mom pale? Was her capillary refill sluggish? Same thing with serosa. If her bleeding lessens and then comes back, that could be a bad sign also. One last thing about lochia. Blood clots are normal in every postpartum patient, but it becomes a problem when they become larger than a softball. That is when we need to notify physician. We need to go back again and look at lab work, physical exam, and vitals. Next, we have your episiotomy. The episiotomy is the incision the doctor will make to make it easier for mom to have a vaginal delivery. To assess episiotomy, we will use the acronym RETA. This is redness, edema, ecchymosis, discharge, and approximation. One thing you need to know about an episiotomy is that if mom urinates, the acid in the urine will burn the incision site. So we need to teach mom how to properly use a peri bottle in order to dilute that urine. Then we have Hohenstein. I have an illustration up here, but I will teach you about it also. First thing we want to do is look at mom's calves. Are they red, swollen, or warm? After we do that, we want to do the Hohenstein. We want to grab mom's calf, and we want to grab mom's foot, and we want to dorsiflex the foot towards mom's belly button. If mom states any pain with this maneuver, it's a positive sign that there may be a DVT, so a positive Hohenstein. If mom does not state any pain with this maneuver, it's a negative Hohenstein and lessens the chances of a DVT. Last but not least, we have emotional status. Moms go through a lot during labor. Their hormones are out of whack. They're trying to get used to this new role of being mom. If they have kids, they might be worrying about their kids at home, or they may be getting used to a new role of having a new baby again. So we want to be their support system and recognize the signs and symptoms of postpartum blues, depression, and psychosis. Postpartum blues are normal in about 40 to 80% of pregnancies and deliveries. They usually resolve on their own, but if they don't, it turns into postpartum depression. Postpartum depression presents with lethargy, lack of wanting to do anything, and just not wanting to interact with their baby or their family after delivery. Postpartum psychosis is like depression, except they have hallucinations and delusions. Postpartum psychosis patients will have suicidal thoughts and thoughts of harming their family, and they will follow through with it. Postpartum depression will also have suicidal thoughts and thoughts of hurting their family, but typically they will not follow through with the plan. So our number one priority with psychosis, since they will follow up with the plan, is safety. Safety for mom, baby, and the rest of the family. I also want to bring up a subject of attachment and bonding. We want to make sure that mom is attaching and bonding to her baby, and we can be proactive and look for signs that she is not. Is she feeding her baby? Is she changing her baby without having to be prompt? Is she talking about her baby? Or is she just laying in bed and having the nurses do all the care, or the family? These are all signs that we should be aware of as nurses of depression and psychosis. That's all for the bubble HE exam. Remember, breast, uterus, bladder, bowel, lochia, episiotomy, Holman sign, and emotional status. There's one more thing I would like to talk about. During mom's whole stay, we will have to educate her on different aspects of becoming a new mom and dealing with labor after she goes home. So I found this acronym, post-birth. Post are the symptoms that you would want to call 911 for. So we have pain in chest, obstructive breathing, seizures, and thoughts of harming yourself or your baby. Birth are signs that you want to call your healthcare provider. This is bleeding, which includes soaking through a pad an hour, incision that's not healing, redness or swelling in your leg, that could be a sign of a DVT, temperature of 100.4 or higher, which can be a sign of infection, and a headache that doesn't subside with medication and includes blurry vision. This is all for the postpartum exam. If you have any questions or comments, you can put them below and I will happily answer anything.